So, Mr. Chinedu Anaje, it's very nice to get to meet you finally in person. Um, we know that you are in the co-owner of the Courtland Health company, and we're actually coming here to get to know more about you as a person and also about your business. You know how you started off your career path.
Okay, thank you very much. My name is Chinedu Anaje. I'm one of the owners of this business, Courtland Healthcare Services. We started off in 2015. My wife is an RN as well, so we've always had this vision of setting up a business that will cater to people with different needs. We have a passion for helping people and making sure that people live their best possible lives. So my background is in IT. I've worked in IT as a software developer for years, probably 10 years. And but during all that time, I've always had this inburning passion in me for healthcare. I've always been fascinated about health and how to live optimum lives. I've always been fascinated about treatment protocols, herbs, procedures, medical inventions. I actually come from a family of medical professionals, so it was only natural for me to have that burning passion. So having worked in IT for a long time, I at a point I got to realize that this is what I really needed to be doing. And my wife already was a registered nurse, so it was only natural for me to transition to healthcare. So I went to nursing school and graduated as a registered nurse, and we've had this business running since 2015, and here we are today.
Oh, that's so lovely, and glad to hear how you made that transition from being from IT to the healthcare industry. I know that every company has its challenges, but so what are some of the biggest challenges does your company face as in today, especially in the health sector?
Okay, the major challenge we face today in this industry is staffing. Okay, but that's not something that's peculiar to just us as an organization. It's more like an industry-wide phenomenon. So yeah, staffing is the major issue.
Yeah, definitely for sure. Especially in all sectors, that definitely, especially here in the US. What would you say is the biggest strength of your company? What differentiates your company from every other health service care?
Okay, our major driving force is waking up every day and wanting to make a difference in the lives of people that we face, that we come across. We love what we do. We're very passionate about what we do, and we believe so much in people. We care about people. We feel that everyone is special, and that they deserve the best possible care that they can get out there. So what makes us different is the passion that we have for people and the love for what we do.
So like every other company I know during this was like 2021, we had the COVID issue that came up, and that generally affected a lot of companies. So how did that period in time affect your company, and how were you able to transcend from that COVID era?
Okay. It was an unfortunate period in the world, right? We had our share of challenges, and as you know, a lot of businesses went under during that period. It was, I must say, a very difficult time, but we were able to weather that storm and we were able to remain open during that pandemic. You know, during the lockdown, we were forced to implement COVID measures, one of which was working from home, just to keep everyone safe. But as much as we possibly could, we had caregivers going in to take care of clients. And of course, they had to adhere to the COVID regulations, the COVID protocols, you know, with the masking and the hand washing and use of gloves, maintaining a safe distance. Thankfully, we didn't have any incidents of infection during that period, especially at the height of the pandemic. We did not have any incidents due to the measures that we put in place, and we're very proactive, you know, in how we provided service to our clients.
What makes your organization, what gives you that unique selling point that separates it from its competitors, especially if a client or a patient is looking for healthcare services? What makes your company unique from other?
Okay, so we are family owned. That's number one. So being a family owned business, we bring the concept of family into running the business. We treat everyone as we would treat our family members. We provide care to everyone because we believe that everyone, you know, like I said before, deserves to be treated very well. So we're family owned. We are professionals. We understand this industry. We are nurses. We are healthcare professionals. Unlike some companies that are owned by people that don't have a background in healthcare. So we understand this industry very well. We understand what it takes to care for clients. We understand the emotions, the challenges. We understand basically everything that has to do with caring for a client, especially in the comfort of their homes. We are coming from a background of home health. Okay. We've done this before, deciding to transition into running our own business. So we understand this industry, and that's what sets us apart. We bring a personalized approach to care, in the sense that for every client we take on, we seek to understand what their needs are, what their family dynamics are, what their goals are. We give a listening ear to them. And based on all the information that we gather at the beginning of the whole process, we are able to create a personalized care plan for them, a plan that suits their needs, a plan that they actually have an input in. So that way we try to minimize issues as they come along. We try to because the goal is to keep them in the house. The goal is to keep them as healthy as possible and to prevent hospitalizations. Okay, so each patient gets a personalized care plan, and we have experienced caregivers, very passionate, dedicated, who are also trained in what they do. We run background checks on everyone, just to make sure that, you know, people that are not supposed to be taking care of clients are not hired. So we have quality checks along the way. We've put in place different things just to make sure that our clients get the best care.
In line with what you just stated in regards to clients, you know, giving them the health care they desire, you know, and the process you go about it, what perception do your present clients have about your organization?
Okay, from my understanding, the perception is a positive one. We have testimonies from several clients to our commitment, our selflessness, dedication, and of course to our approach when it comes to patient care. We've had several clients come to us to say, hey, ever since I've been getting home care, and I've been to several companies before, I've never experienced the kind of care that I'm getting from you guys. You guys are just different. I mean, those testimonies, such testimonies are very common, you know, in this environment. So yes, the feedback is very positive.
Right. Now that's heartwarming to know that you get such positive comments from your clients. You know, and also we know the sector that we are in. You know, how do you stay informed about the industry trends and developments as regarding healthcare?
Okay, so we do a lot of research. We belong to we hold memberships in different, you know, groups, healthcare groups, networking groups, and of course we have access to literature. We try to stay abreast of happenings. We keep track of the patterns, of the trends. We are very particular about technology, so we stay ahead of the game when it comes to that. We're very technology driven here, so we try to stay competitive through information, through networking, and through building relationships across the board.
Okay, you know, it's good that you mentioned technology. So we know the coming of artificial intelligence has come into the scene. So would you at any point in time ever substitute an employee with AI? And if yes, in what position would you make those changes?
Well, as far as patient care is concerned, technology is indispensable. That's a fact. It has come to stay, and I believe that it's not intended to take away that personal, that personal touch that comes into healthcare. You want to be able to have someone, help you with a cup of coffee, or maybe make your bed, or maybe do some light housekeeping around your house, or even someone to talk to, right? That desire is never ever going to go away. So, unfortunately, I don't see how technology can meet that need. So that human element is very, very important. It's very important for patient outcomes. It's very important for human interrelationships. So I don't see that going away anytime soon, if it ever will. Where I see artificial intelligence playing a big role is probably in the area of maybe data gathering, analytics, maybe business intelligence, so basically pretty much everything that has to do with planning patient care, or making sure that patients are safe. But as far as providing one-on-one care, I don't think robots would do a great job of of providing patient care. So as far as one-on-one patient care is concerned, that personal touch is always going to hold that spot.
Well, in line with your company culture, people who are your patient and clients are always very particular about the kind of organizations they deal with and how they treat their employee. So, are you the kind of company that is very responsive to your employees in terms of listening to their opinions? People always want to deal with organizations where they have some sort of affluence with their employees. So, what is your company culture, and do you have your employees as your trustees when it comes to your organization?
Definitely. We do have a company culture that centers on, you know, having an open door communication, right? We want everyone to have a sense of belonging, and we want everyone to be able to express their feelings or, or their displeasure regarding any issues that they may face, right? We are very approachable. Management is very approachable. I do. Our employees actually have direct access to management. They have their emails, they have their phone numbers, and what have you. So there's no. We have every available means of communication at their disposal. We try to create that openness because we feel like everyone is special, right? We want to see everyone excel at what they do. We want to see everyone excel, and be able to say down the road, "Hey, I'm glad I worked for this company." We want to leave a lasting impression on their minds. We want to change the perception that an employer or a boss is not approachable. We want to change that perception of boss employee divide, where certain employees may feel that the bosses are not approachable, or the bosses see themselves as the gods. We do things differently here. So that's the company culture that we operate within.
All right. So what will be your goals for the company in the next 5 years? What is your prediction?
Okay, so in the next 5 years, we want to go into other areas of healthcare. We don't want to see ourselves. We don't want to be seen as a company that does just patient care, home care. You want to be able to diversify. You want to be able to build other avenues. So in the next 5 years, we want to be seen as a company that does home care, a company that does IT stuff in healthcare. We want to be involved in other things, other activities, and we want to be involved in emerging trends, emerging business concepts, because we're very futuristic here. We keep an open mind, and we want to make a mark, and we want to be known as a company that that is very excellent at what it does.
All right. So, something you would have wished you have known before you became a CEO or co-owner of a company.
Okay. Well, the fact that there are hurdles that you didn't see coming, in trying to get a business up and running. It's not just about the expenses, but you will encounter hurdles that you never knew existed. There's a lot of bottlenecks, and there's a lot of bureaucracy out there that you will have to grapple with in trying to get a business up and running. So there are things that I saw down the road, and I was taken aback, but then we were not discouraged. We just had to sit and figure out the best ways to overcome those challenges.
Okay, so just to pipe down this interview a little bit. So what do you do, as your favorite pastime? What do you do to relax?
Okay. I love to cook. I love to travel, and I love to read. I love to research a lot. I mean, I do a lot of research. I love history. I love anything that is related to fitness and healthy living. I'm always looking for new knowledge and, you know, trying to stay relevant in the scheme of things.
All right, that's cool. So if you could live anywhere in this world, aside America,
okay,
where would it be?
Okay, of course I would love to live in Africa. Yeah, I'd also love to live in probably the Caribbean, maybe Cuba.
I do appreciate the time you've given to us, you know, getting to know more about you as a person and also about your organization. And we wish you the very best success in your endeavors, and hopefully your organization tends to get to the highest heights.
Thank you for having me.